welcome to AirSculpt TV. We are coming to you live from Minneapolis. We are currently in the OR, as you can see, so we'll give it a couple of minutes just to let people join. But thank you so much for joining us today. We are doing a full abdomen today with Dr. Farrugia.
Hello.
And our lovely patient Emily here.
Hi.
Okay, so Emily, I just have a couple questions for you. How are you doing so far?
I'm doing well.
Yeah?
Yes.
And what are you feeling?
I'm just feeling a little bit of vibration.
Perfect, perfect. So what made you decide to choose AirSculpt for your procedure?
I chose AirSculpt because of the quick recovery time afterwards. I have 4 kids and a husband, and we're busy, and this is little to no downtime. So it seemed like a perfect fit for me.
Perfect, perfect. Dr. Farrugia, would you tell us a little bit about what you're doing?
So we have Emily here, and today we're doing an AirSculpt of the full abdomen, and we have already done the left waist, and now we're proceeding to do AirSculpt of the right waist. And Emily, you mind if we show them the result on the table at least of the
Sure.
of the left waist?
Sure.
As you know, we have a very nice operating room.
Look
As
at our
operating room
view.
goes, you see it all frozen because it's Minnesota in the winter, but it's usually a large lake with a fountain in the middle. Reminds me of the Bellagio, actually.
Perfect.
Okay, so we had Emily kindly turn
All right.
to us to see us the results
Look at that.
of the left waist, and as you can tell, it's very different than the other waist. Now she's getting that hourglass shape that she wants. You can see also some markings for the landmarks that we make to guide us. An important area is obviously the buttocks, because you have to have a precise idea where that starts and ends, so that you keep the AirSculpt to the areas that you want it to get. Another area, an important area, as you can see, is this diamond-shaped area that ideally should be skin on bone. Like that, it separates the cheeks of the buttock and makes the buttock stand out, even if you're not doing a BBL or gluteal augmentation.
Wonderful. Thank you so much for explaining that to us, Dr. Farrugia. Emily, tell me a little bit more about how you feel about being awake during your procedure.
We can have Emily. She can turn on her bed.
I love being awake. It just makes me feel a lot more comfortable to know what's going on, and that I'm able to talk to the doctor, and he's able to explain things even as he's doing it.
Perfect.
So it's great.
And just for fun, tell us about the music that you chose today.
Today I chose to listen to Lady Gaga.
Great choice. Great choice. Is she a favorite of yours?
She is.
Wonderful. Okay, so let's go ahead and have Dr. Farrugia show us a little bit about what he's doing.
All right, so we're gonna go back and continue what we had started, which is the right waist. We have the AirSculpt cannula here. And we're going to continue. As you can tell, it's a very comfortable procedure. And I'm extracting the fat that goes and collects in a canister behind me.
Amazing. And you're still doing okay, Emily? It looks
Yeah,
like
I'm
it looks
doing
like
great.
You're just relaxing.
Yep.
Wonderful.
As you can tell, I have 2 hands on the field. You might think that this is the right hand that's the most important, but actually it's the left hand that is the most important, which is the hand that's guiding me to make sure that I am at the correct depth, and everything is proceeding as it should.
Wonderful. So we're actually going to answer a couple of questions that we're getting from you, the viewers who are watching us live here. And the first question that we have is, what are the BMI requirements? And we actually do not have any BMI requirements. That is one of the beautiful things about the AirSculpt procedure. If you can pinch it, we can take it. When you come into your consultation, we will sit down with you and discuss what you're looking to achieve and go over all of that information with you, but there are no requirements. Okay. If you have any other questions, feel free to enter them now. We'll see if we can get to a few. In the meanwhile, it's so fun to watch people getting sculpted. Okay, so one of the other questions that we just received is what procedure is he doing? He's currently doing the full abdomen. So the full abdomen is going to include both the upper and lower stomach area, as well as the waist and hips. So it's going to give you that nice snatched effect. And Dr. Farrugia is the best in the business when it comes to that. So Emily is definitely in the right place.
I agree.
Clearly, one of the other questions we're getting is she in pain? And clearly she is not. She's very comfortable, but Emily, I'll let you speak to that.
Yeah, I'm really not in any pain. It feels like a vibration. And I'm not in any pain right now.
And Dr. Farrugia, this might be a great question for you. One of the questions we just received is how soon will she see results?
Well, we say that the final result is at 6 months, but you can definitely see results way earlier. I always give my number to the patients right after surgery so that if there's any issues, they can text me or call me right away. And usually, even by the second day, they're telling me how their waist looks already snatched and they're so happy with the result. Obviously, the final result will take longer than that. You have to go through an internal healing process where everything settles and the skin tightens around your new form. But the results, you can see it almost right away.
Perfect. Okay. Another question. What is the recovery time?
Well, the recovery time varies. I've done AirSculpt on many people that went back to work the next day, even nurses, and I tell them, what are you doing here? They say, I'm feeling fine, and can send them home at that point. But I would say that within a day or two, you can go back to doing what you're doing. Sometimes I call patients of mine to see how they're doing after surgery the next day, and they're out shopping. So it's very individual, but I would say it's much faster than you would expect.
Perfect. Another question, where are we located? We are actually located technically in Edina, so we like to call our location Minneapolis, but if you're familiar with Edina, it is a suburb of Minneapolis, and we are in the Centennial Lakes Office Park. So it's a beautiful office, it's a beautiful operating room, it's a great view, so makes it nice and relaxing to have your procedure done here with us. Let's see, what other questions do we have? These are great questions coming in. Keep them coming. How long does the procedure take?
It depends on the number of areas that you are doing. Usually, a full abdomen would take around an hour and a half. If you are adding a gluteal augmentation, or what we call a BBL, or a fat transfer to the breast, you can add another half an hour to that. And then, other areas that some people might decide to add to the same procedure, like arms, thighs, chin, they would take approximately an extra 20 minutes to half an hour per area.
Perfect. All right, the next question. Do I need to prepare anything for the procedure? The answer to that is no. You do not need to do any prep work. When you come in for the consultation, we will explain the entire procedure process, the before, the during, and after to you thoroughly. But there really is no prep work for you to do prior to coming in to have this done. And the next question, up to how much fat can be removed? And the answer to that is 5 liters. So you can actually take a quick peek at how much fat has been removed here from Emily. A lot of patients also love the fact that while they are awake, they're able to see the fat literally coming out of their bodies. So that's That's always a fun and exciting thing to watch. The next question, is numbing being used? Yes, we do use local anesthesia to make it very, very comfortable, as you can see. Okay. Okay, so I think that does it for this segment. Thank you so much for joining us today. It has been my pleasure to try to fill the shoes of Dr. Rollins, and of course, always a pleasure to have Dr. Farrugia with us and to watch a patient transformation right before our eyes. So thank you again for joining us, and hopefully we'll see you soon.